Anessa Larson. I'm out here for my patients. I'm out here for parity between mental health and the medical services that Kaiser is saying that they're serving.
I thought it's required by the law.
It is.
What's happening?
Well, apparently we're only looking at access, but not the next appointment. So my next appointment is February 10th. As of last week, Friday, you won't be able to be seen for an individual therapy appointment for probably 8 weeks. That's not good care.
And have there been complaints filed at the state level for them to force Kaiser to follow the law that requires treatment for mental health care?
There absolutely have been complaints, but I don't know if Kaiser is paying any heed to them or if it's important. I don't know.
You think they should be prosecuted criminally?
That's important to think about. I think Kaiser does a lot of good services in other places, but I think in terms of mental health, yes, I think that what they're doing to my patients is criminal.
And when somebody commits suicide, I mean, is that a concern that you have when you're not able to treat patients?
Oh, all the time. I'm working longer and longer hours just to have patients be seen outside of the hours that I'm supposed to be working or the hours that I'm paid, because I have so many patients that I need to see and they go into crisis. I can't just push them into hospital. They're not getting all the care that they need there. So I have to be able to see them to be able to stabilize what's going on.
And Kaiser has been fined in the past millions of dollars for violating the law as far as treatment and timely treatment. What does it say about the state oversight that they continue to do the same thing?
I think there's a big message that they don't care.
What does it say about the state not enforcing their own laws? I mean, should they do something about it? I mean, if they fine Kaiser millions of dollars and they continue to do what they're doing.
There seems to be no teeth. I don't know. It's as you said, maybe there's some criminal action that needs to happen. The thing is I don't know where people at the top go to get their mental health care. Because it seems like if they were to come to Kaiser, they wouldn't get the kind of care that they would probably want.
I think they have a different treatment plan.
Maybe so. Maybe so.
I mean, they're making millions of dollars apparently.
Yeah. Yeah.
How long have you worked for Kaiser?
For 3 years. And I'm at Kaiser Permanente in Vallejo.
And how many times have you been on strike?
This is our second time. Last year we were out here around this time of year. It's not what we want to do. It's not where we want to be at this time of year. But yes, this is our second time. We're not getting the contract. This is not about money. This is about patient care. We want to be able to serve our patients in a timely manner. And timely doesn't mean just first time to get access to a therapist. It means ongoing therapy.
And what do the families say who are trying to get treatment for their wives or their husbands, their children, and aren't able to get it through Kaiser? What are they saying to you?
Oh, they're overwhelmed. They're angry. They're the whole gamut of emotions. Angry, sad, frightened for themselves and their loved ones. And therapists are left holding the bag for that. Therapists are held having to apologize for Kaiser. That's not fair.
And people are paying money.
People are paying money for their benefit. Yes. This is
Is that fraud?
You know what, at that level, if they're saying that they're going to get good mental health care, that is best practices, yeah, I would say that's fraudulent care. Yeah.
So they promise that they're going to provide mental health care, but in reality, for your patients.
They're not getting best practices. Nope, they're not.
What is best practices?
Well, it depends on their needs, but we have so many patients that are waiting so long that so many patients are going into crisis. So at crisis, they need to be seen every other week or weekly for a little while and then need to be stabilized. You know,
if you're not treated, you deteriorate.
You're deteriorate. Yes. Yeah. So, and that's why, you know, I'm holding this, and it's a travesty. It's horrible that this is what's happening. But again, I want to say it's not the people up at the top that are having to make all the discussions with the patients' families. It's the therapists. It's the frontline people who are holding that for all their patients and apologizing for Kaiser's care. And yeah, it's not okay. It's fraudulent care.
What's your name?
Anessa Larson. I'm a psychologist.
Okay, thank you.
Thank you.
When therapists are under attack, what do we do right now? Therapists are under attack, what do we do?
Sal Roselli.
The San Francisco Kaiser, you've been on strike a number of times here over, what are the issues?
The issues are about access to mental health care. Frankly, Kaiser provides good medical care, but not when it comes to the mental health care front. Always been second-class citizen. People are needing to wait 2, 3, 4 months to get a therapy appointment. These are seriously ill people that need care.
Some have committed suicide?
We've documented 22 suicides that were the direct result of not getting access to therapy.
And Kaiser's been fined millions of dollars for not providing care. It seems that they don't mind paying millions of dollars and there's no follow-up. Is there criminal charges? Is there charges of fraud against Kaiser for not doing what they promised the patients they're going to do?
Well, first of all, millions of dollars to Kaiser is like a drop in the bucket. They have a $42 billion cash reserve, so they don't care about the fines. What they do care about is more regulation. Department of Managed Healthcare, which is the government agency that's supposed to be regulating them, has not done an adequate job, and we're going to change that. We're optimistic that Governor Newsom has got a different attitude than former governor had regarding taking care of California consumers versus Kaiser Permanente executives.
And do you think there should be criminal prosecution against the executives? They're required to provide this care. If patients aren't getting it and committing suicide, should they be held criminally in contempt?
Well, that's a new one. I haven't heard that suggestion. I'll tell you, we think that a lot of people should be replaced and moved out because they prioritize profits over patient care. We think the Permanente Medical Group, which is for profit, by the way, it's not a non-profit organization. The doctors here are shareholders. They make huge profits, and their bonuses are based on providing less care. The fewer patients they have, the bigger their bonuses.
And so how many strikes have you been on now here?
This is on the second statewide strike here in this contract. Hopefully it'll move them to come back to the bargaining table and prioritize their patients as opposed to their profit.
What can members of Kaiser do who want to support the mental health care workers?
Just call Greg Adams, and encourage their elected leaders to support us, which has been generally very, very, very good. But they should demand adequate care, and if they have a problem, they should go to KaiserDon'tDeny.org, our website, and we'll do everything we can to help them.
Depression, bipolar disorder, even panic, a combination. People now don't get the return appointments they need because getting treatment, it's essential that you're seen regularly, not once a month, not once every 2 months. So that's the most key thing, and that's why we're out here. It's not money, it's about getting our patient the treatment they need, which means more staffing and more time to do ethical work that we've been trained to do. We're doctoral level and master's level clinicians. We know how to treat patients, but we are seeing so many and they're not providing us with the staffing we need. It would be like if you had diabetes and you were seen for it, you were taught how to take your blood, you were taught how to eat your food, and then you're not seen again until your kidneys are failing.
And isn't it required under law to provide treatment? Isn't it required under law to provide treatment who have mental
That's right, and all the laws, the law is the parity law that says healthcare insurance companies need to provide the same kind of treatment for mental health conditions as medical conditions, and the insurance companies are violating that law, and Kaiser has been violating that law, and they haven't been called to the carpet with it. Kaiser's been paying off a lot of organizations like NAMI and the Oakland City Council because they say we donate to all these programs, so these politicians are backing down. Thankfully, Governor Newsom has been standing with us, and a lot of local city governments are standing with us. They know we're right because we see it everywhere.
And why haven't there been deaths, you say, because people haven't and receive proper treatment.
Right, that's right. If you can't get in to see your therapist and you're desperate, suicide is often impulsive, and if you can't get in to see someone to help you, then the people are desperate and they take matters into their own hand.
Actually,
That's
this
right.
gentleman here, this gentleman in your poster, he committed suicide because he couldn't get services soon enough. And one of my colleagues here, Alex, who you were just talking to her, she's friends with the wife, and she was involved in this case and finding out about how he couldn't get services soon enough.
Let me tell you, there have been lawsuits, but you don't hear about them because they're settled out of court.
Why hasn't the state filed criminal charges against the executives? They're required under law to provide this treatment.
Good question, because Kaiser has a lot of money, as well as the other insurance company, and they pay off people.
What about Governor Gavin Newsom and the OSHA and all the departments, the Department of Insurance? Couldn't they?
That's a good question. That's a good question. Why aren't we filing lawsuits? Good question. Thank you.
It might get some action from these executives.
That's right.
If they file criminal penalties for not doing what they're required to do. Have you personally had to not been able to take care of patients you wanted to because of the rules and procedures?
Absolutely.
Talk about that.
Every clinician here has not been able to see their patients in a timely manner. They've been told they're not sick enough to get the treatment in specialty mental health departments.
What does that mean, not sick enough?
Well, they're not severe enough. We used to cynically joke, are you feeling suicidal? Yes. Do you have a gun? Yes. Is it loaded? Yes. Is it cocked? Is it pointed to your head? That's how you get in to see at Kaiser. It's not funny, though. People have died.
What does it say about healthcare in America? I mean, Kaiser is a wealthy...
You know what it says about healthcare in America. Right now, this isn't the climate to care about people that need help. This isn't the political climate to care about people, and we're trying to run against the political current of not caring, that if you have money, you're not supposed to help those in need. Well, we're out here to say, yes, we are, and we're professionally, it's unethical for not to treat our patients.
Kristen Mullen. I've been at the child team in child psychiatry, San Francisco, 13 years.
And are children having the same problem getting appointments, or is it different for children?
It used to be Maggie Wilson brought me on board, and I had said, I don't want to work for Kaiser. I heard you can't do weekly treatment. She convinced me to come because we had a lot of good programs going on, but it's gotten worse, and now they're doing phone appointments, phone intakes, and we can get people in, but then we don't know how to treat them because we don't have the space to hold really complex cases.
This is children. This could be a life and death question for children.
No, seriously, I was crying the other day because they sent the manager sent me an email saying I needed the EAP, the Employment Assistance Program, and I was like, excuse me, this is not an emotional issue, this is an ethical issue, because my patient is an eating disorder patient who severely needs eating disorder treatment, and we don't have an eating disorder specialist in San Francisco because she left because she was overworked and she was the only one. And so now they just dump it on us generalists. And we have people on our caseload who should not be on our caseload. Because generalists, we can see people once every 3 to 6 weeks. I mean, we just don't have the ability we can get them in, thankfully, on our team, but we can't treat them up front consistently,
I mean, Kaiser is making a lot of profits. That's been reported at this rally. They're required under the law to treat people equally, a physical injury or a mental injury. Why are they ignoring the law?
They say that they're treating. I mean, you wouldn't believe the emails I get from Kaiser where it makes me feel guilty. I'm like, well, am I doing something wrong? They spin it such that we're to blame, and I can't even take time to go pee, let alone do anything other than see the patients that I'm seeing. So my husband can attest. He's a school teacher, and he's always telling me like, you have to leave Kaiser. It's not good for your health. But I love the patients I see. I love my team. I'm a Spanish-speaking therapist, so I see, yo estoy trabajando con mucha gente que habla español, and me encanta eso, but no hay mucho espacio para hacerlo.
Do you think these executives should be held accountable criminally for refusing to provide care? I mean, they say that they provide care. I mean, you think it's fraud?
I seriously think it's bordering that. I mean, we try to hold as much as we can, and we are doing a good job some of the time, but we just can't see them enough based on the level of need and the number of clinicians we have.
Medicine and as a gender therapist in Oakland. And I'm out here on strike and up here speaking today because I'm so deeply frustrated and dismayed and ultimately disturbed by our working conditions and the inadequate care, thank you, our patients are receiving due to Kaiser's deficient model of mental health care. As a social worker, my professional ethics mandate that I advocate for the underserved. And currently, that is nearly everyone I serve, because they are not getting the timely access to care. It can take months to get a first appointment, and then months to be seen a second time, and then a third. Patients get worse while waiting to get in, and then it takes longer to get better because treatment is delivered at a slow drip. So I find myself here, ironically, following the advice of Bernard Tyson, who apparently said, "Don't ask permission to help improve the lives of the people and communities you've pledged to serve. Instead, march through the doors of red tape, make bold moves, and usher in access for your communities to be served." So here we are, making bold moves, pushing through red tape, and fighting for a model of care that enables our patients and the communities we serve to get access to timely, effective mental health care. Personally, I spent a year as an intern before I started working for Kaiser, and when I was hired, I understood I was choosing to work for a large HMO and would not be doing weekly therapy. But I never imagined the model of care would actually get progressively worse over the years. With schedule management and now with phone intakes, patients are struggling more and more to get just that initial connection with a therapist. I want to break down what this is looking like from my role in behavioral medicine. Increasingly, it is common for this to be the scenario. A patient calls triage and they have an initial phone conversation with someone in psych triage. They are then booked into a phone appointment with someone at a hub somewhere, and they tell their story another time. They are then booked in with a depression management nurse back in Santa Rosa, and where they tell their story a third time, and then finally they are booked with me. They get in to see me, and they are now telling their story for the fourth time. And this time, though, they're sitting with someone, and what comes to light is that actually they're in crisis, but they weren't comfortable telling the details to someone they were never going to see again, who they were only talking to over the phone. And so now I'm sitting with them, trying to hold what they have held on to for maybe a month, and realizing what they actually need is that initial appointment in psychiatry that is still 6 to 8 weeks out. And they are waiting longer, and they are struggling in the process, and I'm angry. I'm increasingly embarrassed and appalled when I am in those appointments. So I overextend myself to compensate, contributing to my own burnout. Some patients end up getting held more in places that aren't the best care. They're not the level of care they need. Some lead more on primary care doctors who are already overburdened and not necessarily comfortable holding and managing psychiatric issues, while others end up in the emergency room as their symptoms escalate while they're waiting for an appointment. Yet we bring this to Kaiser and we are told we are being unreasonable. And they insist to the media this is really all about money. I'm so tired of the doublespeak and the misinformation. We are told we are richly compensated compared to other therapists. But we know we are also working in worse conditions than most therapists, with impossible caseloads filled with increasing acuity and chronicity, and they refuse to compensate us the same as their other unions. We are told there is a shortage of therapists to fill vacant positions, but we know they are subcontracting to many therapists who do not want to work for Kaiser despite the financial benefits because the caseloads are impossible and they can't provide care in the way they were trained. We are told that despite this, Kaiser has hired hundreds of new therapists, but we know those new hires are often therapists who are replacing therapists who have left due to burnout and disillusionment, and that many of the new hires are actually clinicians transferring internally to find some position, some small team, some niche where they feel they can be remotely sustainable. We are told we provide the best evidence-based treatment. Yet we are sent to feedback-informed care trainings that emphasize timely front-loaded treatment that we are not able to provide. We are trained in Kaiser's own ACEs research showing timely mental health care can improve both mental health and medical health outcomes, and we cannot provide it. We are told Kaiser is the national leader in mental health care, but we know that while they fund campaigns to end mental health stigma and encourage people to seek help, they will not provide the steps to actually deliver the care that is needed on the ground. And finally, we are told Kaiser doesn't have the money to make these changes. But we know Kaiser is happy to pay millions in corporate sponsorships and has made $6 billion in profits this year and has more in reserves than the state of California. Meanwhile, patients are suffering with depression, anxiety, bipolar disorder, trauma, grief, postpartum depression, and just the strain of severe work stress, divorce, financial crisis, and family conflict. We are living in a time of heightened stress from the high cost of living, mass shootings, political divisions, and climate disasters that ripple through people's psyches and in turn their relationships and their lives. Nationwide, there is a crisis in the demand for mental health services. In Santa Rosa, we have seen this up close in the wake of multiple wildfires that have traumatized our community. And we are here because we are all skilled, dedicated clinicians ready to provide phenomenal healing care. We just need Kaiser to step up and truly become the leader in mental health care it claims to be. We are ready. We have been ready to partner with Kaiser to do this. We are asking them to come back to the table and agree immediately to improve access to initial in-person and return appointments and provide us with the time for case management so our members and our communities can receive the effective treatment they deserve. Thank you.
My name is Ted Vanderkloot. I'm a licensed clinical social worker and have worked as a psychotherapist at the Department of San Francisco Psychiatry for 20 years. I do individual and group therapy for adult patients who are suffering from severe mental illnesses like depression, bipolar disorder, post-traumatic stress, and schizophrenia. Many are experiencing emotional, physical, and sexual abuse. Some have recently lost their jobs or marriages or been diagnosed with a life-threatening illness. My patients are often at the lowest points in their lives, and some are seriously contemplating suicide. Yet patients I see often have to wait weeks or months to get in to see me. After I have done the initial assessment, the next availability in my schedule is often not for 6 or more weeks out. And my situation is not unique. All of my coworkers face similar circumstances. All of you face similar circumstances. We're all in this together. This is largely because Kaiser does not have enough mental health clinicians to adequately meet the needs of our patients. There is one clinician for every 3,000 patients at Kaiser. My coworkers and I each have 400 to 500 patients on our caseload at any given time. Both Both initial and return access has been a terrible problem in our department for years. Because of this, in 2013, the Department of Mental Health in Sacramento levied a $4 million fine on Kaiser and established an access metric that Kaiser was required to reach. Even despite this, however, it is my understanding that to date, Kaiser has only partially met this metric. Nearly every day, I and all of you are sitting with a patient in severe stress, and our schedule says that our next appointment is not available for 6 weeks. It is painful and frankly embarrassing to sit with a suffering patient and have to tell them I cannot see them again for another 6 weeks. That is wrong. And because I and most of my coworkers cannot bear to do that, we end up having to book patients into our lunch and paperwork time slots in order to provide the level of care that we deem appropriate. Doing that, however, leaves us no time to do the vast amount of paperwork that's required. As a result, I often stay at work until 8, 9, or 10 at night to complete my paperwork before going home. And we don't get paid for this extra time. So Kaiser puts us in a position of having to burn ourselves out in order to responsibly treat our patients. They make us burn ourselves out in order to responsibly treat our patients. It is not okay for Kaiser to do that. It is not good patient care, and it is not a respectful way to treat staff. Kaiser systematically burns clinicians out, which makes our understaffing problem even worse. Kaiser upper management is either completely oblivious to this dynamic, or they just don't care, and both of which are completely unacceptable. Instead of taking responsibility for the severe access problem that they themselves have created, Kaiser's upper management has instead chosen to shift the onus of the problem onto therapists like ourselves, demanding that its already overworked staff work even harder. But we didn't create this access problem. Kaiser's upper management did. Yeah. They need to look in the mirror and take responsibility for their role in the crisis. Kaiser upper management, you need to look in the mirror and take responsibility for your role in the crisis. Stop trying to pawn it off on us. Now, my coworkers and I have known the solution to this problem is that Kaiser needs to hire more mental health clinicians. It's a mathematical question. If a region has a certain number of members, Kaiser needs to have an adequate number of mental health clinicians to serve those members. Kaiser upper management has refused to do so. This is irresponsible, shameful, and derelict. Despite its nonprofit status, Kaiser Permanente makes billions of dollars a year. Yes, you heard that right, billions with a B. Kaiser reported that it earned a net income of $5.2 billion in just the first half of this year. Yet instead of spending those ample funds to hire more psychotherapists, Kaiser has chosen to pay $295 million to the Golden State Warriors for sponsorship rights, including naming rights to the area outside the team's downtown stadium. Additionally, Kaiser is spending $900 million on a new office building for high-level administrators across the bay in Oakland. Needless to say, Kaiser's priorities are terribly skewed. While my coworkers and I put our blood, sweat, and tears into helping Kaiser's psychiatric patients every day, Kaiser is not supporting us, but rather is making it harder. In order to save money in our last contract, Kaiser decided to cut our retirement health benefits. Now think about that. After dedicating decades of my life to caring for the health care of Kaiser patients, Kaiser is rewarding this commitment by reducing my health benefits and all of your health benefits at just the time in our lives when we're going to need them the most. This in itself is enough to sicken me. Kaiser often claims it wants to be the best place to get health care and the best place to work. Well, if Kaiser really wants to practice that, they need to learn to respect and support its psychiatry patients and psychiatry staff. Upper management needs to learn to put people over profit. People over profits! People over profits! Plain good business to do so. When clinicians feel respected and appreciated, they stay at their jobs instead of going to look somewhere else to work. Kaiser executives will find that the better they treat their workers and the better they care for their patients, the more people will join Kaiser and the fewer staff will leave. Meeting the needs of patients and staff is a win-win situation. But Kaiser upper management does not see this. They have been blinded by greed. Kaiser needs to wake up and see the light. Put patient care first and hire more mental health clinicians. Put patient care first and hire more mental health clinicians. Put patient care first and hire more mental health clinicians. Thank you.
My name is Rena Hernandez. So the sign No More Suicides is talking about the folks who have waited to see clinicians within the Kaiser system who have actually committed suicide waiting. They feel like they have nothing left. Even folks who are within the treatment system wait 6 to 8 weeks to come back in for a return appointment. And I think that the way that sometimes they get around that is by providing a lot of group treatments. So they're drop-in groups, other things like that, but folks also don't always feel comfortable accessing them and they don't always give them the help that they're actually looking for.
Hey, I'm here with Housing Rights Committee of San Francisco, and we're here with Jobs with Justice. And I have to first say that there is no way to separate housing stability from mental health care. And on one level, that means making sure that healthcare workers get paid what they deserve and they get the benefits they deserve to be able to stay in the cities they work in. But I want to say that last year we had 5,000 people come through our office, and a lot of those, the majority of those folks were in crisis, and many of those folks had mental health issues. And the difference between being able to stay in your home is what kind of mental health care you get. And when your landlord is harassing you and banging on your door every day and lying to you and saying you need to get out of your apartment, you're in crisis. And that is when you don't need to wait a month and a half to get an appointment. If you're going to be able to make it through one of the most stressful things you can go through, you're going to need everyone's back. And all of you are what help keep people in their homes in San Francisco. And I have to say, this is a really personal issue for me. My father had really serious mental health issues, and he was a rent-controlled tenant in San Francisco. And I know that when he was in crisis with his housing, I am thankful he didn't have Kaiser, because I know his city clinician kept him in his housing. And all of your tenants, all of your clients deserve that.